How many of you take care of patients with HIV who have diarrhea and have problems? They can be very tough to deal with among all the other issues. They're very difficult to treat. They can severely impact the quality of life and the quality of your life if you're taking care of them. And then there's a lot of problems. There's a lot of the patients are underinsured. They have Medicare, Medicaid, and it can be a real challenge. So this study looked at this product, and this is important. It's not just getting people feeling better. It improved the duodenal immune reconstitution and absorption function. And I'll show you the data. This is an open label in patients who had HIV enteropathy. So they had to have chronic symptoms, including loose or watery stools and increased stool frequency, despite no identifiable reversible causes. So these are people already worked up. They had extensive testing to exclude any possible pathogen, particularly those that might affect an immunocompromised host. They were tested negative for endomysial antibodies, and they also had a lactose-free diet trial first. In addition, while they could stay on chronic anti-motility agents, they had to be washed out from antibiotics other than PCP prophylaxis, and they actually had to meet with a licensed dietitian to exclude food intolerance too. So they had to go through all these categories to make it into this trial. It was a validated GI questionnaire that looked at stool frequency, the consistency, which I'm going to show you in a minute, the Mertz scale, cramping, urgency, incontinence, nocturnal bowel movements, and they score a 0 to 39 total score, with normal being less than 4. One thing that you can do is you can do the Mertz stool scale, which actually is a visual scale where the patient points or indicates what does their stool look like. In addition, they did disaccharide gut permeability at the beginning and the end of the study, D-xylose absorption, upper endoscopies with duodenal biopsies, and then serum markers of microbial translocation, inflammatory cytokines, and fibrosis, collagen kinetics. So it's nice to talk about theory, but then you actually want to show the proof of concept that this product may be making actually a difference measured in objective means. So this was a study timeline, and these white arrows are when they had the blood and stool tests, and the green stars when they had the upper endoscopy with biopsies. They were screened, they entered, they got basically one packet, so a half packet twice a day, one packet's 5 grams, for 8 weeks. Then there was a 4-week period of time where no one got treated, and then they went on to get out to week 48. And during that 4-week washout period, it's interesting, 6 of the 8 patients relapsed with their symptoms again. 5 of them elected to continue then on to week 48. 1 of them, though, was lost to follow-up. But 2 of the 8 did not relapse, and they did not continue on the product by their choice. So just to remind you, 8 HIV-positive males in the first part, and then after the washout, 5 of the 6 who had relapsed continued on to week 48. Here are the results. The blue is baseline, and the orange is week 8. So there was a big decrease in median bowel movements per day, in median daily stool consistency scores, and then median daily GI symptom scores dramatically, as you can see, decreased. And this is the median for the population. This is week 8 data, so this will be all 8 of the patients. And then over here, if you look at stool frequency, you see a decrease to week 8, and then these are the 5 patients who continued on to week 48 in stool frequency, and then the stool pictorial scale. So staying on the therapy, it looks like you have kind of a maintenance of, or further improvement in some patients of their already improved situation, which is nice. Now this is where it gets really interesting. Mucosal immune constitution or reconstitution. So peripherally, remember these are HIV patients, peripherally the CD4 T cell counts were unchanged, but they had upper endoscopies with biopsies of the duodenum, and in the duodenal lamina propria, the CD4 lymphocyte densities increased. So this shows the CD3 to CD4 lamina propria cells, and this is the LPL ratio in the patients. You can see that most of them had very nice increases in the duodenal biopsy. So again, peripherally it stayed the same, but in the intestine they all improved. There is additional biomarkers that were looked, and if you look over here, this is called monocyte chemoattractant protein 1, or MCP1. This happens to be a control group. This is the baseline. So this, compared to controls, it was elevated at the baseline in these HIV-positive patients, the monocyte chemoattractant protein, and then this fell in 5 patients who continued for 48 weeks. So you saw this improved, And these levels negatively correlate with the CD4 lymphocyte density. So as your CD4 lymphocyte density is high, which is what you want, you actually have low levels of this protein. So you want to be down on this area too. So again, showed important changes in the findings on the biopsies. This actually shows here, again, negative correlations between the MPP9 to TIMP1 ratios and elevated concentrations of the CD8 lymphocytes in duodenal lamina propria. So again, you get an inverse relationship. And then this one over here shows you higher levels of the enterocyte damage at baseline compared, again, correlated negatively with the recovery of the lamina propria CD4 positive cells. So if you have more CD4 cells, you have less damage. So you're getting damage, the CD4 cells get reconstituted and decrease the damage that we believe is contributing to the enteropathy. So somewhat of a summary. Here's baseline, here's week 8. This is duodenal biopsy data. The CD4 lymphocyte densities increased in these patients. You can see the increase over here. And at the time that this study was done, and perhaps still this is true, this is the first intervention that demonstrates a substantial increase in duodenal galt lymphocyte populations in HIV patients. So this is why this is so interesting, because it actually made changes that you could see biochemically and on biopsy in these patients in which other interventions had not done. In summary, bowel movements and improvement in stool consistency, remember those pictures, improved in all the patients, and there was also vast improvement in GI symptoms. So the patients felt better, which is hugely important for quality of life outcomes. Intestinal absorption increased in 7 of the 8 patients, and then the CD4 T cell lymphocyte densities increased in the lymphoid tissue in the gut, and the enterocyte damage marker initially rose but then decreased below baseline. And again, it was safe and well tolerated. There were no SAEs through week 48, which is the end of the trial, in those remaining 5 patients.